Good afternoon. This is Media Center Ukraine Odessa. We continue our work for today, and now we are going to have a briefing dedicated to healthcare in Odessa and results of the work of the Odesa Regional Council. We're having with us Nataliya Odariy-Zakhar'eva, Director of the Healthcare Department of the Odesa Regional Military Administration, Yuriy Lebedev, Head of the Legal Department of the Office of the Odesa Regional Council, and Serhii Bratchuk, Spokesman for the Head of the Odesa Regional. The floor is to Nataliya Odariy-Zakhar'eva. Good afternoon, dear residents of Odessa. Good afternoon to everyone who are here today. We're thankful for being invited here because we have a lot of information to share. I've been the director of the healthcare department for 3 years now. First, I was acting director during COVID times, and then I was appointed as the director. I'd like to say that we have we have completed healthcare program in Odessa region for 85%, despite the invasion of the Russian Federation. The department has managed to create its team, headquarters, and we work 24/7. A lot has been done, not only in Odessa region, but in neighboring cities, Mykolaiv, Kherson, and on the whole territory of Ukraine. I'd like to thank those who are staying here and those who defend Odessa and the whole Ukraine on the front line, those medical workers who are staying in the country. This is very important because there is always shortage of medical workers, and now we have 80 doctors who are in critical condition. Thanks to the state, thanks to the president, the Ministry of Healthcare, the Minister of Healthcare, and the heads of regional administrations, city councils, and thanks to the population in general, we have significant achievements. We have properly equipped hospitals. The hospitals that have medications, fuel, generators who are fully ready to operate during blackouts. We have opportunity to provide quality healthcare services, and Odessa Oblast is now on the first place in the country when it comes to the accessibility, including 150,000 IDPs, our military, their families were always open and ready to provide aid. And of course, we care about our children. Donors support children hospitals now, and the state always monitors the situation with regard to support of children hospitals. I would also like to mention the necessity of vaccination, and our children are our future, the future of the independent Ukraine. Thank you. Serhii, you can provide information about the security situation in the region. I would like to offer Nataliya Odariy-Zakhar'eva to cover other topics she's supposed to cover. And of course, I'm ready to report about the security situation, but I will share details later. Today, we've had the session of the Odesa Regional Council, and the Healthcare Department submitted 7 items for consideration, including reorganization of our healthcare institutions, for our hospitals to be capable of providing services, but it also envisages the decent salary, the enough amount of medication in hospitals. There were the questions of handing over the equipment and the property. There were some other issues related to firing managers of on some institutions, and I would like to say that during the war and in the future we are not going to deal to oversee the situations with the corruption. There are other projects, including with regard to psychotropic substances, embezzlement, financial discipline. I would like to say that the department communicates fully with the directors, with other institutions. We work 24/7. And we have been working in such regime since the beginning of the COVID pandemic. And we are always ready to visit the remote parts. We check activities of our institutions. We have opened clinics. We have vehicles that are ready to take elderly people to the medical institutions or to provide health care services on the spot. There is the project of the First Lady related to mental rehabilitation, which covers not only rehabilitation of our servicemen, but also their families. Summarizing, I would like to say that the level of healthcare in our region has improved. I have a question, and then I will give the floor to my colleagues. As far as I understand, there has been appointed the assessment and the verification of activities in 2 medical institutions, the tumor hospital, and 1 more. And of course, there is the reason why we have decided to organize this inspection, because we've got information with the abuse of medication to people, patients with oncology. And we have also received complaint from a woman whose son died in that hospital. So the information is open. And then we initiated the investigation. This is as for the Onco Center. And as for the Medical Forensic Center, this is the question to Mr. Lebedev. I'd like to add a few words to what has been mentioned by Ms. Odariy-Zakhar'eva. I'd like to say that all communal institutions are under constant monitoring by the relevant services and departments of the regional military administration. If there are any facts found that speak about violations of the employees, managers of the institutions, we organize inspection. As for Forensic Bureau, we've received numerous claims against improper organization of the providing paid services and other violations. That's why we have decided to inspect this institution. Basing on the results of inspection of both institutions, we can speak about a range of violations that speak about improper organization of the managerial properties, putting harm on the activities of these institutions and our citizens who get healthcare services there. Taking into due account the results of the inspection, we have submitted 2 draft decisions for the consideration of the session of the Odesa Regional Council to fire the directors of both institutions. Because there is grounds to believe that these managers are no longer efficient. I'd like to give floor to my colleagues. Irina, the floor is yours.
Today, I'm John.
Just a second. They're going to.
Thank you very much indeed for taking time to talk to us today. I'm John Cookson from Arise News. Hundreds of billions of taxpayer dollars is flooding into this country all the time from the US, the UK, the EU. What assurances can you give us that it's reaching the right place? Because my encounters with people in areas that have been rocketed is that they're pretty much on their own in terms of getting medical care and general help. And how much of this money is being lost to corruption, and what are you doing to stop that?
I can, if you allow, I would like to answer the question. Dear journalists, as for your question, I'd like to firstly thank all our Western partners, our allies, not only from Western countries, but I would like to thank all states who support Ukraine to repel Russian aggression and to achieve our common goal, the peace. As for the amounts of the aid from our allies, this is out of our competence and area of responsibility. Perhaps your question is more related to the occupied territories like Kherson Oblast. And I'd like to recommend you to address this question to the heads of Kherson Regional Military Administration. As for our region, all the partner contacts that we have are efficiently used, and we do everything possible to achieve our victory and peace. Thank you. If there are no other questions, I would like to share information about the security situation in the region. Yes, very briefly. The situation has not changed if comparing to the previous day. And as for the Black Sea, there are certain battle units of the Russian Federation, including 2 missile carriers, namely submarines, that could have around 8 caliber missiles. Of course, we keep emphasizing the risks of mines being turned off from their anchorage because of storms, and these mines could reach the coastline of Odesa region and the city of Odessa in particular. I'd like to remind that everyone should follow the established rules, and I would like to thank those citizens who inform about dangerous items that they could find on the coastline. And people don't make selfie, but they inform the relevant services as soon as possible. As for the threat of missile attacks, I'd like you not to think about so-called sacred dates, some events in our calendar. Please follow and mind the rules when you hear an air raid alert. This is the most important thing. And of course, information hygiene. Every time I emphasize information, the importance of this thing for being mindful. I'd like to say that the main objective for this year is to control over effective management and to proper organization of the work of the institutions, to pay salaries in time, and to have no credit debt. And also for the institutions to provide quality and easily accessible healthcare services. I'd like to wish the whole country and our region in particular health and safety. I have one more question. You've mentioned that there is a lack of doctors, and then you've mentioned the number 80. You mean that 80 of them have been mobilized to the armed forces of Ukraine, or what do you mean by this? 116 medical workers have been mobilized since the first day of the full-scale invasion, but every 2 weeks we have rotation for our medical brigades to go to the front line with the equipment and medication needed. So this is additionally to 116 medical workers who have been mobilized since the very beginning. Yes, and we've lost the young surgeon, Andriy. As a student, he joined the team of medical workers with the beginning of COVID, and we have already losses because he was killed. Thank you for being here today. Thank you for sharing the latest details with regard to work of your department. And Roman, I have one more question. You've mentioned the discharge of the 2 heads of medical institutions. Are there any criminal investigations initiated already? Yes, if there are the facts proving the possibility of criminal violations, we provide the relevant information to the law enforcement bodies for them to initiate the investigation and checks needed. We hope to receive results as soon as possible, and the criminal proceedings will be initiated with regard to those persons who are at fault at damaging the activities of our institutions. Thank you. Thank you. That was the briefing in the Media Center Ukraine, Odessa. Please stay tuned, and we continue our work the next week. Thank you.